So what Greg's going to do, he's going to describe what the journey has been like from his perspective as a husband, okay? So I really think you should pay attention to what he has to say.
Thank you, Dr. Craig. It's kind of hard to believe that I'm sitting or standing up here today and talking to you about where we are. We've got a 6-year-old daughter, 4-year-old son. Probably been about 14 years. Shannon and I eloped, got married. Within a couple months of getting married, she started developing a tremor in her arm and some sharp shooting pain where she would just kind of twitch some. She had just finished medical school. We didn't know what was going on, so we went to see a primary care physician. He didn't know what was going on. He referred us to a specialist, to a neurologist, to a pain doctor, to UNC, Vanderbilt, Duke. We ended up in a hospital at the University of North Carolina, and they gave her an injection in her arm and her shoulder to try to stop the spasming, which was basically her arm would just do this almost all day long. And at that point in time, they told her that it was a psychological problem and she needed to see a psychiatrist. She was crazy. This is after they gave her an injection to try to paralyze a muscle in her shoulder, and I remember holding on to her. She sobbed. She sobbed so hard that she was just everything pouring out. And when the doctor finished, his head of neurology at UNC, he looked at her and said, for God's sakes, woman, you're going to handle yourself. You're a doctor. At that point, prior to that point, I thought, we'd go to see a physician, they knew what they were talking about. They went to med school. I just needed to listen, to support. And that started our journey from me starting to question that if I didn't believe in her and support her, I don't know what we were in store for. And it went on for, when eventually found a tumor in her arm, that same visit that she was told that she was a psychiatric case, we demanded to get an MRI. They did an MRI, they found a tumor. Unfortunately, the pain didn't stop there. She went from having pain in her arm to it starting to, her arm, you saw it kind of got leathering, and there was ulcers that went all the way down into her muscle, spread to her other arm, and her legs, and up in a wheelchair. And we found ourselves in Mayo Clinic after about 7 years, and we were told that she had 2 years at best. She had heart arrhythmia, she had, her vessels were locked up. She was on so many medications, over 250, 300 milligrams of opiates. She was either completely drugged out to where she could barely even know where she was, or she was in so much pain that she was just shaking and crying. And we ended up going from Mayo Clinic to trying to get into an experimental medical treatment in Little Rock, Arkansas. And we got to Arkansas, and after a lot of preparation, they told us that she was not a candidate for the trial because she was too high of risk. We came back to Orlando, and I remember we went in our room, and we probably stayed there for 2 or 3 days, cried. We thought it was it. We were being advised by her multiple sclerosis physician where she was diagnosed with MS, but found she didn't have it. We were told that we just needed to prepare her for the inevitable, make sure that we had taken care of all of our legal will. Shannon woke up or got up out of bed after about 3 days after being turned down in Arkansas. And I had been doing research on my own for almost 8 years since the point when she was, I felt like, when the physicians were not believing her, I started to do my own research. And we were reading about this coma trial, this drug ketamine that they were using in Germany. And we talked about it for years, but she wasn't, early on it was just her right arm. We never thought, how can anyone ever be in a position to look at taking a drug to put you in a coma or dissociative state, we didn't see that as something that we would want to pursue, but we got to a position where that was our only option. We reached out to Dr. Kirkpatrick. Within a couple months, Shannon was in Monterrey, Mexico, put into anesthetic coma, and within 30 days of the coma, she was walking for the first time in a year. Within 6 months, we were pregnant. She was pregnant with our daughter, and it's been 7 years. We're working full time. We're trying to find a way for her not to work so we can spend more time at home with the kids. But we were in a position where we thought there was absolutely no chance that there was anything other than, I thought that it was just a matter of time and I was going to be a widower, and it was nothing we could do. And I'm very, very, very fortunate that we were stubborn, that despite that we had a lot of care that was subpar, we found some brilliant physicians, some wonderful people, friends, family, various people at different stages when we thought we'd just give up. And they gave us just a little bit to help us get to that next day. And now we're, it's almost like, look up there. It's like I'm looking back at an old movie or a dream, something that it was there. I know it was real. I remember, some of the stuff I can remember like it was yesterday. But we're living a completely different life now. And which is very, very appreciative for the foundation and for Dr. Kirkpatrick. I'm appreciative for my wife, for fighting. Life is worth fighting for. And no matter how much the deck seems stacked against you, there's always an open window somewhere you want to look for. And I hope I don't forget that. Sitting with a 6-year-old daughter and a 4-year-old son, where I get locked up in work and traveling and stressed out over the various things in life, and I have to step back and look at that and say, you know what? I don't care what's going on. Life is good. That's life is good.